Earlier this year, the Washington Post published an article entitled "The Eyes May Be the Window to the Soul, but the Ears May Be the Route to Our Hearts." And really what they were talking about is something that you're all familiar with, which is it's so much easier to understand what somebody meant when you heard what they said versus whether you read what they said. And you've probably had this experience when you've received a text and you're like, what do they mean? And they didn't reply to you, and you didn't really find out what they meant until the next day. And that's really difficult, but it speaks to the fact that we communicate so much more natively with emotion and with our hearts when you talk to somebody. I think someone you might recognize said this quite well. Helen Keller said, "Blindness separates us from things, but deafness separates from people," because it is that interpersonal communication that is so essential to being human. And this affects a lot of Canadians. 1 in 5 Canadians have hearing loss. Many people in the room know somebody that has hearing loss, and it actually gets significantly worse with age. Almost 50% of people who are 65 and older have hearing loss. With our aging population, and in fact doubling over the age of 65 in the next 25 years, this becomes an increasing issue. And just to put a solid number on that, in US terms, 10,000 people a day turn 65, half of which will have hearing loss. So that is an enormous number of people approaching that are going to have this problem, communicating with their families. You know, it's also noise-induced hearing loss that is actually the most common cause of workers' compensation. And a paper from The Lancet this last year also demonstrated that hearing loss is the most modifiable risk factor for dementia. If you want to avoid dementia, the biggest thing you can do is make sure you're having those interactions and communicating with people. Similarly, as mentioned, almost 500 million people worldwide have this problem. And so it can affect you on a daily basis as an adult. It limits your interactions, but what effect does that have? That can increase isolation and lead to depression. That has higher costs for healthcare because you don't understand the instructions and also treating the depression, etc., as well as a lower income. And there's something that can be done about that. And in kids, where I work at a children's hospital, of course it reduces their future impact by causing speech delay, social isolation, and possibly a lower achievement and demonstrated lower income later in life as well. We have a big problem though, and this is a quote from the head of the American Academy of Audiologists, is that we have 50% too few audiologists to solve this problem. So not only do we see it coming, but we are totally incapable of dealing with it. And so the real only solution is to change the way that we deal with it. And we do so by using technology to increase the number of people that can deliver this kind of care. It creates a tool that's easy and it can be done in different places. And that's really the impetus for SHOEBOX, which is essentially an iPad-based game audiometer that takes an iPad and converts it into a medical tool. Something that could be used possibly by your family doctor, your school nurse, the family physician, and supporting it with big data to help you make decisions once you know what the answer to the hearing test is. Because just getting the hearing test is step 1, but step 2 is now what do you do about that? Some of the big data is really interesting. This is based on 200,000 audiograms over the last few months. And if you break it across age, everything in blue is normal, but everything in green is someone who needs a hearing aid. It means that they have enough hearing loss that they need a hearing aid. And so how do we pull those needles out of the haystack? And this is where big data starts to really be helpful. And this has been happening in places all around the world, in 54 different countries, sometimes this is Divine Mercy Babies Home in Uganda, which is an orphanage for children. On the bottom, this is one of the many industrial sites in the world where people are exposed to noise. And on the far side, in schools, this is actually a photo from Iqaluit where children up there are getting their hearing tested. I mapped out the last 20,000 audiograms just on the map there, just to see where the impact was happening. And every 3 minutes, a new hearing test is being done, which really contributes to the knowledge that we have about how big is this problem, where is it, and what should we be doing. I wanted to loop back to this quote just in the context of, I want you to think about, whether or when, the moment when you heard your child say something, or perhaps the words that you heard the last time from a grandparent. And it just really hits home how important this is to our experience as humans. And that's really SHOEBOX's mission, which is how do we democratize access to hearing healthcare so that everyone can participate in the listening environment of being human. Thank you.